I mean, when we look at even just like the beginning of the education of physicians, we don't see any specific training on LGBT identified people, trans people in particular, but also LGBT folks as a like general umbrella. So it's really the physician's job, when they aren't getting that training, to train themselves. It shouldn't be up to your patients to come in and answer those questions for you.
I think that's really common with a lot of medical providers, is that they're not given cultural competency training or training to deal with people that are not heterosexual cisgender.
Sometimes there is also angst within members of the LGBTQ community of their orientation around like going to doctors in general. Sometimes it's not even about, oh, I want this procedure and insurance won't do it. Sometimes it's like, I'm going to the doctor for, it could be any number of things, and I don't know how that experience is going to be because I've had this negative experience in the past.
I mean, where to begin? I think like there's less of an understanding of the way their bodies work. I think a lot of times because of the violence and discrimination they face, they're afraid to tell their doctors about what's going on, when in fact the doctor should be there as an advocate who listens and understands everything. I'm from the Milwaukee area, and Milwaukee, as most people know, is a highly segregated area. It's really challenging for a lot of communities in Milwaukee, particularly like low-income communities, communities of color, queer and trans people that live in these areas, to get like high-quality, inclusive health care.
State health excludes trans care, right? So even for identical drugs, hormones, or procedures, it's not covered if it's related to a gender transition, and it is covered for other things like hormonal birth control, thyroid hormones, or for example, mastectomy or breast augmentation. So there's an explicit exclusion on trans care.
The challenges that people face definitely depend on their identity, right? So I think in particular intersecting identities.
So it's important to not just think about like queer and trans identity when thinking about this issue, but to also consider race and ethnicity, ability, or what else, class.
I think that then the push to get people to get tested for STIs, we have to make it as comfortable as an environment as possible. So part of that looks like really making sure that our providers like have an understanding of queer identities, right? Queer and trans identities.
Making sure that we have protections in place for all people, and also making sure that every medical professional has comprehensive, inclusive training. I think that's really, really important, and I think it's underrated.
I don't think there's one way that this is going to get solved. I honestly think it's like, see where you're at, see what resources you have, and then move from there.